All right, you all see the presentation?
Yeah, you're good.
Yep.
All right, so good afternoon, everyone. I want to take some time this afternoon to walk us all through the progress of our Return to School Task Force, provide a high-level update to the board and to the community regarding the conversations and the work that's taking place. As was mentioned in the board member comments, I have to give high kudos and commendations to all of our staff who have really contributed countless hours to updating our documents, developing plans to address our response to returning to school in August. And hopefully, as we go through today's presentation, as the board, you can pause and ask questions so we can get to clarity as to where we are and what we're hoping to accomplish here. So the cover slide here, educating students in a changing world, really is apropos for this moment in time. We have never seen or experienced something like this in my 22 years in education. And frankly, I hope we never experience it again because it is quite taxing to all of us as a team in BCSD, to our parents and to our students who definitely are not having the opportunities to be in school engaged in learning. As Doc just mentioned, he walked us through. Doc talked about our values, vision, mission, our goals. I want to talk about our core priorities because the great challenge that Doc has put before us in this work as a task force and myself as the task force lead is to not compromise our guiding principles. We must remain committed to the values and the vision and mission statements of our district and to these four core priorities. And so as a task force team and as a larger educational services division, we continually revisit the ideas of a culture of collective efficacy, the importance that every single individual who works within the organization, their belief system matters, their efforts to come together to support the students in our district will be more important than ever before. And that we have to remind everyone that as difficult as this time is, we have 31,000 students and their families who depend on us to develop and deliver a meaningful educational experience for them that's going to relaunch on August 12th. Priority 2, a culture of teaching and learning, and we are grappling with the reality that teaching and learning is going to continue to evolve and change as we prepare for return to school, and that this idea of blended learning continues to grow in the reality as we prepare for the return. And our plan and our goal and our priority to develop as much of a synchronous real-time learning experience for our students who may take the option of being at home or due to the guidance of launching a 50-50 model of return, will be forced to engage in learning from home rather than in their seats at school. To a culture of student-centered schools and to the current climate that exists both locally and nationally, we are working to be prepared to support our students, to support our teachers with the resources and materials to elicit conversations, to allow kids to express their thoughts, feelings, and emotions, and to work to build understanding as to the current reality and history of our country and how we can grow together to ensure that we provide our students with the most meaningful learning experience to be prepared for their next phase of schooling, whether that be the junior high experience at BCSD or if it be on the current high school district or some other high school. And then core priority 4, a culture of access and inclusion to ensure a multi-tiered system of supports for all learners. This is all about enriching and supporting those students who need intervention. And again, as part of our curriculum subcommittee, which I'll talk about in a few moments, our team is working diligently with classroom teachers across the district to really build out a robust roadmap for how we're going to support kids who will have been out of school for almost 6 months when we return in August. So this quote was provided by the president of the International Society for Technology and Education, and it was shared in a county office up north. And I thought it was apropos again for our conversation with our task force and the planning that's taking place, that this is a once in a generation moment to rebuild schooling in a way that honors the unique strengths, interests, and abilities of students. This disruption has underscored the need to think beyond rigid schedules and place-based learning, and instead allow for innovation in pedagogy and delivery. And so this is the main work of our curriculum team as we redesign our instructional program, how we're going to deliver content, how we will support students, which is becoming more and more of a reality. It's going to look more like our March to May period of instruction as compared to the first 3 quarters of the school year. But we still have time to get to that conclusion of what our plan will be to come back in July for August 12th start. So our task force has come together as a team to accomplish this goal, to establish a comprehensive return to school plan for the students, staff, and families of the Bakersfield City School District. We will achieve our goal by the following: ensuring our district leadership team works together to understand and address the significant challenges we face with reopening schools. Some of those challenges are the continuation of guidance documents that offer us tweaks to the recommendations regarding face coverings and high-touch areas, and sanitization, and social distancing. Documenting our process in order to build a full communication plan to the stakeholders of the Bakersfield City School District. And we will produce a document that is going to line out exactly what our expectations are for the return of school, so that every stakeholder understands what our position and what our expectations are across the various departments and programs of our district. And ultimately, our priority within our goal is to establish ongoing contingency plans for any future closures due to COVID-19. And we do expect to have the school year disrupted at least a few times with the current rates of virus that exist within our community. So we are working against the clock now. We have a limited number of days between now and August 12th. We will bring forward the final recommendation to the board on July 14th, and each staff member is working diligently to formulate their recommendations to be submitted to me as a task force lead in the coming weeks. Now, as I mentioned earlier, we have a plethora of guiding documents that have come forth to us from various entities, including the Kern County Superintendent of Schools finalized and released their thinking guide for opening schools in late May. The California Department of Public Health released an updated COVID-19 industry guidance, which included schools and school-based programs guidance. June 8th, shortly thereafter, the California Department of Education released their Stronger Together, a guidebook for the safe reopening of California's public schools. And then the following day, the California School Boards Association released their document, The Uncertain Road Ahead, Reopening Schools in the Time of COVID-19. Now, prior to that, and within that time sequence, we also saw additional guidance documents, which really started with the release of the latest updates from the Centers for Disease Control and their considerations for schools. And then in late May, ACSA, the Association for California School Administrators, released their school reopening reports for the upcoming school year. And then we also have the Cal-OSHA guidance, which follows the California Department of Public Health. And so there's a lot of content that we read through and understand and begin to plan for what is our response in terms of protocol development and expectations for our staff, for our students, and for our families as we prepare to restart school in August. And so just to provide an overview for everyone of what exactly encompasses a task force response from trying to organize and plan for the opening of a school district the size of BCSD. So we have our general task force, which is 26 members, including district and site administrators and each president from our three associations. We have an instructional task force that includes 43 members. Proud to say that that is a predominant majority beta members, classroom teachers, site support staff positions, our apples, our coaches, our intervention specialists, working together with principals and district administrators really to dig into the crux of our instructional program for next year, really trying to build focus and alignment there, where we're not overwhelming teachers with the expectations of teaching in a normal year. Next year will be anything but normal. And so our goal there and priority is to build confidence in our teachers that they can accomplish the goals and priorities of the district. And to accomplish that, we are reducing down our focus standards and what we identify as essential, while also building into that learning the prerequisite and scaffolds necessary to support teachers with closing that achievement gap and supporting kids to access grade level content. We also have a 27-member mental health and social emotional learning task force. That too includes district and site administration, teachers as part of our beta membership, and classified employees as well. And that work in coordination with our instructional task force is all meant to build one document, one instructional plan, and how we're going to build time and space for our teachers to support our kids with all of the trauma and SEL needs that they're going to have when they return to school, so that we're not competing against the clock, because the reality is we're going to have to retrain our kids on how to enter back into school. And a big part of that is getting kids to express their emotions. And we're going to have to reteach that for our students to be successful there. We also have a principal task force, which includes one of our area administrators and 4 of our school site principals, one from each service delivery model area, who meet to really begin to frame out all of the operational aspects at the school sites. They're creating a frequently asked questions document. They're also starting to work on some expectation protocols so that we can have clarity as we get into July to begin to set the path forward for what the expectations will be for staff when they are on the reporting side to complete their duties. And then we have an employee health and safety development task force, which includes members from our human resources department, our school health department, and Dr. Fullenweider, who are working through the extensive creation of protocols and safety measures so that when staff come back and return to work for the upcoming school year, they will have watched a video, they will have signed an affidavit that they completed the video training, they will understand the expectations as it relates to personal protective equipment that we require, social distancing, and the patterns and routines that are going to be significantly different for our staff to ensure a safe and healthy work environment. And lastly, our directors from our maintenance operations, our nutrition department, our stores and purchasing, and our transportation department working together to frame out everything from equipment in our school sites, such as plexiglass, to how we're going to provide meals to students, to the organizing and ordering of materials and equipment, to investigating our transportation system, given the guidance on how we must position students on a bus for the upcoming school year. All of which leads us to the identified challenges that we are working aggressively to address as part of our task force. Challenge number 1 being the ability to meet expectations of daily sanitization of facilities. And as the board saw in the binder, you're going to come to the presentation here shortly, There are various scenarios of what it's going to take to ensure that our facilities meet the standard of expectation, not of cleaning, but of being sanitized. And those are two very different definitions in the COVID-19 world. Challenge two is the ability to meet expectation of PPE equipment. That is the procurement of cloth masks. That is the procurement of hand sanitizer and soap, and all of the things that we're going to need to make available on our school sites, in our classrooms, and in our departments at the education center for our staff, so we can maintain, again, a safe and healthy workspace. Challenge number three, the ability to meet the expectation of daily health checks of staff and students. And so we have ordered, they are en route to delivery, they may have already been delivered, thermometers for all of our school sites, for all of our departments. And this will be a protocol we put in place where we will scan for temperatures at anybody who enters into a district facility. And if you are over 100.4, you will be going home as a measure to ensure the safety and health of our staff members, both at the school sites and at the district office or satellite offices. Challenge four, the ability to transport students to and from school. This is a significant issue, and I'm going to pause here because the first four challenges are immense, both individually and in the totality. One interesting item that came up at our last task force meeting, specifically with the transportation of students, is that oftentimes our parents will either walk their children or drop their children off at the bus and then go about their work day or their personal day. The reality is that any child who shows up at a bus stop, even if their temperature is scanned, and even if they are above the 100.4, must be transported to school. That's a legal requirement of our bus drivers. Our bus drivers do not have the ability to turn students away if there is not a parent present with the child. So that is going to factor into our transportation conversations, as well as just the sheer capacity of what we traditionally transport to school, which is approximately 9,000 students, and what the guidance, as you saw in the binder, allows for in the upcoming school year, which is about 3,500 to 3,800 kids if we place a child, one child per seat on our buses. So that's going to take more time to work through, but we are going to see significant challenges there. Challenge number five is the ability to feed students without using cafeteria space. As part of the guidance, it's being recommended that school sites identify a sick room for any individuals, including staff who show up and become ill during the day. It would be a best case scenario to identify a sick room where you have restroom facilities available so that students aren't traveling longer distances and inadvertently exposing other individuals to their illness. And so we are contemplating identifying the cafeteria as that sick room. But that's still yet to be finalized as we move forward into our investigation of all of our campuses, because each campus is uniquely a little different from the next. So moving on to challenge number six, the ability to maintain staffing numbers to educate students. There's a myriad of factors here. One of the factors is how many staff members will require a leave due to a myriad of reasons, personal health issues, daycare, childcare issues. And so we want to do our best to be prepared for that, which leads us to challenge number seven, the ability to access the necessary number of subs, given how many teachers may take leave. And generally speaking, in a given day in our district, we have a certain number of staff who are on leave for the general maternity and or medical leaves, when we add the potential COVID-19 leaves above and beyond that, very likely it may strain our system. And so we're going to work diligently to be prepared for that, but that very well may be a pressure point for the organization. Challenge number 8 is the ability of teachers to teach in a blended model of in-person and virtual. And, I want to commend all of our staff, our teachers, because nobody asked for this to happen to them on March 18th, and our staff jumped in and did the best of their ability to meet our demands to support kids. And so our responsibility as we move forward to finalize our plan in any kind of a blended model is to make sure we provide the training necessary to support our teachers to be as successful as they can be in anything other than an in-person setting. And again, the likelihood is that we're going to face some blended model of instruction at some point in the school year. Challenge 9, the ability to effectively teach small group reading instruction given the current guidance on social distancing and masks. This is going to be a challenge for us. We are investigating how to build barriers between kids, how to create space at your small group center, how to reduce the size of groups to allow for more space. Literacy continues to be a priority in our district and a goal to close the literacy gap. So we don't want to lose sight of the importance of small group instruction and teacher-led instruction. We're definitely going to have to adjust our traditional planning to accomplish this goal. And then challenge number 10, the ability to accomplish all of this given the 10% reduction in our district's budget. And so kudos to the team though, because we have amazing leaders across the district who are working diligently to identify best solutions for our district.
Mark?
Yes.
You want to see if the board has any question? And also, before you move on, can you go back to slide 8, Mark? So just as a reminder to the board, Mark, in his efforts to lead this task force, as you can see, we definitely have a lot of collaboration going on within our district, and we spent a lot of years building a collaborative shared decision-making culture. And so these individuals are putting forth a lot of effort in that. Again, Nathan, that's slide 8, there you go. So with that, Mark, I think we could stop there and you can see if the board has any questions as you move on, but that's a lot of information to digest, but it's important information, especially those 10 challenges that Mark discussed with the board.
I'm going to go to the first set of challenges here, challenge 1 through 5, and ask, are there any questions related to any of these 5 challenges from the board?
I have some questions on challenge 3. Let's say that you have to send a few students home or teachers home that that people suspect may have COVID. I had mentioned that maybe we ought to have like, I don't know who would be transporting those students or those, well, mostly the students, but it appears that it might be a good idea. I don't know if we have the funds to do that, but I thought it'd be nice to have like a district shuttle where you have the driver protected with PPE and maybe plexiglass, and then you can distance the students, because I know right now that, different people transport children home when they're sick, and that's going to be something that might compromise some of our employees if they have to be transporting children either from school, or it could even affect challenge number 4, the busing situation, challenge number 4, yeah, 3 or 4. So in terms of transporting children that may have COVID and be at school or that are suspected, how's that being handled?
So we're gonna,
or what conversation have you had about that?
So we're gonna have to, in our discussions with Dr. Fullenwider and Terry Lindsay and Terry and Tim and Aaron Johnston, with Christine, they're working right now to develop all of those protocols for how we're gonna handle situations such as that. We are not going to compromise staff's health to whatever extent possible with the take home of students who are exhibiting systems, which is why the recommendation and the guidance that we will implement, which is the sick room reality on a campus. We expect that sick room is going to be required to be used. We also want a large space because, to that same point, Lillian, when you think about a sick room, well, somebody on campus has to man that and supervise those kids. And again, you want to ensure that there's distance and space between staff and students. Our expectation on the front end is going to be every parent who receives a call as a result of an ill child will come and pick up their child. There's going to have to be a lot of flexibility on both ends between schools and parents, in that either the parent comes the moment, picks up the kid, or the kid very well may stay at school the entire day in the sick room, because we are going to limit their access to other people and try to place them in a controlled environment to the best of our ability. But that will definitely be one of the protocols that we develop and distribute as part of our response plan on July 14th.
But we both know that the expectation and the reality are not going to match for a great number of times. And so there needs to be something in place. You might have the isolation room, or the health room, or whatever you want to call it, at school. But I know many students are transported on a regular basis because parents, can't come to pick them up. Their car is not working, or they have a baby that's sick, or, any number of reasons. So that's one of my concerns. And then my other concern is that if you have to send a couple of teachers home and you actually don't have the staff, to take care of the students that have been assigned to them, either because we have a substitute shortage or there's a shortage of additional staff members on campus, there needs to be, something in place to take care of that. And I'm sure you've thought of that, but can you speak to that?
Yes, definitely.
Those items?
Yeah, definitely. The reality for us as an organization is going to be an all hands on deck approach to covering classrooms should staff members become ill and have to go home. First and foremost, if a staff member becomes ill and they've been in their classroom, we have to take that into consideration about sanitizing that space and removing students from that space. We have to think about leveraging, first and foremost, site support staff to serve as that sub in that classroom. We have to look at all of our district office support staff to be deployed out to also cover rooms. This is going to require every member of our district's team to be prepared to fill roles that are unusual and atypical in a traditional year, because all of the scenarios that you've just expressed, Lillian, are going to happen. We are going to have kids who get sick at school, whose parents are not going to be able to pick them up. We're going to have staff who come to work, who get ill, who are going to have to go home, and we're going to have to cover classrooms. And there's going to be a multitude of other scenarios. And part of our work with our site principals right now is asking them, come up with every single question that you've experienced as a site leader, because we're going to have to develop a response to that. And believe me, they've seen every scenario under the rainbow. So we will have a plan on how to respond to almost everything, but the likelihood is something's going to come up that we did not have an initial plan for, and we're going to have to adjust and adapt quickly to address it and respond to it. All of which will have to happen under the guidance of the Centers for Disease Control, the California Department of Public Health, the California Department of Public Education, so that we live within the guidance that's been provided to us.
And Lillian, I hear what you're saying, but there's nothing going to be foolproof, right? We have hundreds and hundreds of staff members and stakeholders working on a plan to prep and prepare for the most effective systems put in place. But there's going to be, obviously, there's the possibility of a situation taking place to where we didn't plan for, didn't think about. So they're looking at all the protocols and procedures that we can put in place to ensure that when students come back in the fall, that that the environment is safe. But again, I don't know if we can plan for every single scenario that's going to happen.
Right. I know it's going to be a huge task. And anyway, I have another question on 9, but I'll wait till to see if anyone else has questions on these items.
Yeah, Mark, I have a concern, question regarding your statement when you said the ability to teach small classes. I thought you said in reading, I thought you indicated the reading in that regard.
Yes, Dr. Haynes. So typically our primary teachers, kindergarten, first grade, second grade, some in third grade, will group their kids for what we call guided reading instruction. And typically those groups are approximately 5 to 6 kids in a group. That will not be doable given the social distancing rules. So the likelihood is that we either establish some type of barrier to go between kids, in addition to reducing the number of kids who can be pulled into that small group setting at one time down to at most 3, most likely 2 kids at a time, just to allow for more space between students and staff. And we also have the challenge of mask, no mask, and how, as a child wearing a mask, can the teacher support the need to watch a mouth movement to help formulate letter sounds with tongue placement, and all of those early literacy teaching tools. So it's going to be a challenge in a classroom, given the guidance to group and deliver small group guided reading instruction. But we are grappling with scenarios now and trying to offer some expectation of that practice that is both doable, but doable in a safe manner.
So then you're not indicating that it's impossible, are you?
No, it's not impossible, but we definitely want to make sure that whatever guidance and expectation we lay out, teachers can accomplish it, and it's done in a safe manner. Again, that social distancing of 6 feet continues to be reiterated in all of the guidance. And then the reality that if you can't socially distance, then wear a mask. Well, if I'm wearing a mask, I can't see the mouth movement of the child to help formulate those letter sounds appropriately. So we are strategizing how best to accomplish that, and we'll have a plan for our teachers.
Well, my concern on 9 is that it's the only time that the word social distancing is mentioned, but that's a huge challenge in of itself. So there's social distancing that you haven't addressed to us in the classroom, on the playground, wherever they happen to be. So can you speak to that?
Yes, definitely. Thank you, Lillian. So currently we have a team of staff members going room to room in our district, school to school, and measuring desk location for 6 feet of space. As a district, we are taking the position that we are going to dictate desk placement to ensure that social distancing, once again, to be in adherence of the guidance from all of the individuals, entities in the state and nationally who are recommending that. So that's taking place now. So that's the classroom example, that we're going to line out where desks go and what is the max number of individuals who can be in that classroom. with 6 feet of social distancing. We are also walking schools to identify and lay out everything from posters that emphasize social distancing, guidance on face coverings, floor stickers that are going to chart out the direction to walk in, spaces that show 6 feet of space when you're standing in a line, appropriately social distancing. So that is all happening now at the school site, not to mention M&O is going through and developing the plexiglass barriers for all of the areas of campus where there is close interaction between staff and the public, staff and students. We're doing the same thing in the education center and all of the satellite offices, everything from the posters, the decals, the stickers, all to emphasize the expectations of social distancing and all that we do. Social distancing also comes into play with busing, in that the recommendation from the state and from CDC dictate a very specific pattern on a school bus, which if we follow that pattern word for word, we would be down even lower in our capacity of no more than 2,000 students, I believe, and it's in the document I believe that I shared with you last Thursday. It's going to be a significant challenge. When you think about the requirement of social distancing, that is going to be one, our greatest challenge to design a school experience that ensures social distancing, and two, monitoring the day-to-day, minute-to-minute, hour-to-hour movement of students and staff to ensure that everyone is fulfilling the requirement of social distancing. And that too needs to occur at the education center and all of our satellite offices, district staff, because we want to, one, model and follow through with the same expectations that we're asking our staff and students to abide by.
When you think of the plans that you all have laid out, and this is a lot of work and a lot of good thinking, the use of the cafeteria, is that still space there for possibilities of the unknown?
So there could be several scenarios of how a cafeteria could be used, but then there are challenges with that as well. So there's been discussion about utilizing the cafeteria as a larger class setting where you could put more kids in there 6 feet apart to socially distance. Some of our cafeterias aren't very big, and so you're not going to get that much of benefit from that. Another issue too that we are listening to closely is what is the max number of people who can be in one venue at a time per guidance, and we're currently at 100. And so even for our larger cafeterias, we're still maxed by that number that's in the current guidance of what the max size is. But then we turn to the recommendation of the sick room, and again, the sick room needs to be a space that has a self-contained restroom for students, so that one, students aren't mingling with other students to perhaps transfer virus, and two, that we can control where kids are going. And so that makes the cafeteria one of the most logical locations for a sick room. And then it's hard to predict on any given day how many students may fall ill. And so we want to be prepared for that and be able to place kids apart from each other as well. So we continue to discuss all of the facilities on our campuses, but beyond the regular classroom space, the two most likely locations for a sick room would be either the cafeteria or the school library. And none of those are perfect. Neither of those are perfect answers to that need.
Well, couldn't the stage be curtained off to be used as a sick room? You know, in the cafeterias, because I think almost all cafeterias, I know not all, but almost all have a stage area.
Yes, and the stage oftentimes, and I'm going to watch that word, oftentimes is utilized by our elementary music teachers
Right.
to provide that instruction. And so I want to honor Mr. Stone's dedication to developing that program and not take that space from him. But that too is an option. That is a logical option.
As
I'd
Mark-
like to go back to number 3.
Sure.
You can leave the screen up like it is, but I just have a hard time wrapping my head around the time involved taking everybody's temperature as they come to school. You know, I mean, that is just daunting when you're talking about upwards of 1,000 between staff and students every day. I mean, what are you looking at time-wise for that? I mean, I just can't even imagine how much time it's going to take.
Yes, you're correct, Pam. We don't know the length of time, but we know it's going to be a lot of time. So if we speak based off of the most recent guidance that we've received really in the last 10 days from both public health and CDE, and we look at what is most realistic in that environment of the 6-foot social distancing primarily, we are looking at a 50% population return.
Mm-hmm.
And you've heard me say before about the all kids back and the challenge we're going to experience if
Right.
we don't bring all kids back. But the reality is, given the guidance, bringing all kids back is going to be a significant challenge. So it's more like a 50% scenario. So now in 1,000 students, we're looking at 500 kids. So perhaps it's staggered start times. Perhaps there are more than one entry point onto a campus, more than one thermometer for staff, and we do an A through L and M through Z. We're going to have to look at all of those scenarios and develop a plan. And ultimately, it may, and very likely at the start, at least, like every first day of school or first couple days of school, it's going to eat into that school time. But we're going to have to build a system, and we're going to have to move kids through it in a methodical manner and get them to class. And so that is going to be a significant challenge for us because we do want to do it in a very timely manner, but it's going to be awkward on the front end trying to take temps for every child and staff as they enter into campus.
And I want to remind the board, as we got a lot more presentation to go, I do want to remind you though that that's why we said that we're going to come back, I believe July 14th is at least a July 14th board meeting with our final plan. And again, we have over 200 to 300 people working on each of those challenges, not only those operational challenges that we've identified, but also the instructional challenges that we've identified. So Mark, and leading the task force, has, like I said, 200 to 300 people working on this. When we come out with our final guidance or expectations document, because remember, we're not going to call it guidance, we're going to be very clear what our expectations are going forward. That document is probably going to be a couple hundred pages long, like every other guidance document out there. But just you have to be patient. But Lillian, I do want to go back to one thing that you mentioned regarding the social distancing. That is going to be a challenge. And we have to take each of these challenges, operational and instructionally, into consideration when thinking about social distancing. And that is something that we're thinking about every step of the way. So, but those are great questions, great feedback, and we're going to continue to make sure that the task force member and then all the members of the subcommittees take all that information into consideration as they come up with the final plan.
I just
have one last question. I'm sorry. I have one last question. Is there going to be like a unit developed for teachers so that they can, that's uniform for the teachers? Because I know the children are going to have to be instructed on hand washing and use of masks and all of the different health components. So is there something that's being put together so that there's some consistency and uniformity for teachers to follow?
Great question, Lillian. Yes. Prior to our closure, we were prepared to launch a series of hand washing videos and hygiene videos, including posters in classrooms and in restrooms for students to follow. So that'll all be part of the instructional plan for the district throughout this upcoming school year. So definitely we have all those resources and videos. We also have developed, I believe, and I'll check on this, but we've also done some video development in Spanish for students and families. We definitely have had different individuals in the district help us create those videos. So that's going to be a vital part of what we do, so that our teachers can just plug and play, show, and walk kids through that.
Good
I just
job.
have, I'm sorry, I thought you were done, Elaine. Go ahead.
I just said good job.
Thank you.
Good work.
Looking at challenge 8 with the blended model, I mean, I know people have had challenges taking the online training for virtual teaching, but I'm hoping that this summer you're going to be able to do some actual face-to-face training for those people who need it. You know, like I would probably be one of those people who need to be right there with having somebody to help me. And because we're actually in that time frame now, if we're going to get people trained adequately before school starts. So I'm hoping there is some PD plan that would allow some face-to-face with people who we have who can be there to help teachers who need it to learn how to do the virtual efficiently.
So Pam, to answer your question, yes, we have training that Mrs. Chapman and I were discussing just before the board meeting started that I need to talk with Sherry and Cabinet about. We have a schedule prepared to move forward. The challenge that we are going to have to answer the second part of your question is the in-person support training, because again, in terms of the guidance, the social distancing piece, that side-by-side in-person model is still questionable. So it's going to get calendared. We're going to plan for both. And then we're going to see what the numbers look like and what the guidance is locally as we move into July. And we'll have that for you on July 14th. We are currently, just to kind of segue, we are currently developing all of our beginning of the year professional development, i.e. kind of what we do for Summer Institute, that training, and our new teacher development, our new teacher orientation. We're developing both an in-person and an online training model, and then we will determine, given the conditions locally, which model we launch with as we get closer to that July, start of August period. We just want to make sure that whenever we do bring folks back into a larger gathering, that we're able to adhere to the guidance and offer a safe workspace.
Just one little question. Was there anyone that you had access to that's had actual experience in teaching or under a virus kind of a situation?
No, not in a virus situation.
Okay.
But we've, as part of the county task force, we've worked with county staff who have been part of the county-wide virtual training sessions that have been going on throughout the closure. And so what I mean by that, Ralph, it's people leading training for hundreds of teachers at one time to gather experience and understanding of how they utilize Zoom to be successful with that training model. But frankly, I don't know of any educator that I know of who has gone through teaching in the period of like a pandemic such as now. I mean, there's always environmental things that occur, but this type of scenario, no.
Mark, you want to continue on
sir.
with the next half?
Will do. Okay. So this slide here was presented to you because in your binder, each of the bulleted items had a corresponding document to it in the binder. And so just for the public's understanding, we're approaching the return to school across three main lenses. One, it's operations and human resources. How will we prepare school to launch, and how will we develop the protocols and the rules for staff returning and working in a different environment? We're looking at all of the academic and instructional program and student supports realities, from our units of instruction to our integration of technology to how we help families who want the only virtual plan. Like, I don't want to come back, I want to stay on a computer, planning for that. Also ensuring that we meet the demands of mental health and SEL and trauma. And then lastly, our stakeholder engagement and communication, ensuring that we are transparent and communicative with you as a board, with our committees and our councils, and that we are eliciting inputs from our stakeholders to help inform our decisions as we go forward with whatever our plan is on August 12th to start school. And so, for the purpose of understanding that there is a significant fiscal impact to working through a pandemic, I borrowed this slide from a AASA, it's the American Administrators and Superintendents of Association, just to understand. So the first column there is all about how are we ensuring health monitoring, cleaning, and disinfecting. And you'll see the cost here for sanitizer. The monthly cost to replenish hand sanitizer is going to be $45,000. And that is with understanding that our staff and our students use it in the most responsible way, and that kids aren't pumping the vial empty of the sanitizer. Disinfectant wipes, it's $10,000 a month. Our thermometers, a one-time cost of $29,000. Our electrostatic sprayers to disinfect, it's a $43,000 impact to our budget. And then every time we close a school down, should we need to, for a deep cleaning, it'll cost $2,500 for each instance. Which isn't, I was happily surprised by that. Now, part of the conversations we've had as well in the second column here is about the need for additional staff to help support all of these efforts. We've talked about additional custodial staff. Yes, we're going to need to employ additional 3-hour custodians to help offset the afternoon sanitization of classrooms. That's approximately an $882,000 cost. If we wanted to go a full-time nurse at each school, if we wanted to have LVNs at each school, that's the reality to the budget that it would be. We're not going to go that route because of that cost impact. And two, finding staff at this point would be challenging. And then if we were to add staff, to address Pam's question of how are we going to screen kids, it would be another between $500,000 and $1.2 million of additional cost, depending upon who the staff position was to conduct that work. So significant costs. We're not implementing or doing anything beyond the additional 3-hour custodian, but this is a significant impact to the budget. And then we get to personal protective equipment and the cost of gloves. If we give 5 pairs of gloves per day for 2 custodians per school, that's $21,000 a month. Masks for students and staff, that's going to be a $94,000 hit, and we are making that purchase now as we speak. And then every time we would replace these masks, we're looking at a similar cost. If we went disposable masks, every time an entire 40,000 students and staff went through one disposable mask, each mask is 50 cents, so it's $20,000 a pop. plexiglass barriers at our schools and in our district offices is going to be about a $50,000 cost.
Hmm.
And then face shields for primary teachers to wear during that small group instruction, that's about $8,600 one-time cost. And then moving to transportation, and you see a blank space there because the reality is that given the conditions of the rules for transportation, it will be highly unlikely that our school buses will be able to run a regular school day route and then run a follow-up route for after-school program activity. Because they would have to drive back to the bus barn, desanitize, and then drive back to their route. So we are going to feel the impact of reduced routes to some form for next year within the day, but significantly impact any after-school type of transportation beyond activities or sports, which we cannot do as of yet, but should we be able to, we wouldn't be able to run late routes.
Mark, is it
Yes.
feasible to put up plastic shields between, each row of seats, like to the back of the bus seats? Because wouldn't that double capacity if we could do that?
I asked that question if there could be some barrier put up between the headrest all the way to the ceiling, and it's not feasible. There is no mechanism to install that structure that's safe, that's allowable on school buses. That's a great question, because we have to figure out some system to allow for more kids to ride a bus. Because so many of our families depend on busing to get to school. The fog machines for busing for the transportation department's $18,000, a little bit over that. And then again, to purchase, install, and upkeep hand sanitizer on buses, it's approximately $10,000 a month. So this is kind of the main picture of what the operating costs for cleaning, disinfecting, and PPE is going to cost the district heading into the new school year.
And Mark, a lot of this is dependent upon talking with Sherry if supplies are available. So
absolutely, Doc.
That is another big issue that we have to take into consideration as well.
Great point. And in the binder, I alluded to it. There are in many cases, there is between an 8 and 12 week response time in ordering these materials. So there is a likelihood that we're going to place orders and we will not have them in stock when school starts. And then what's the response, which is again why we are planning for multiple scenarios for return to school plan. Any questions about this slide?
You said you had borrowed this slide. Now, is this, these numbers, of course, would be dependent on the size of each district, so that if another district borrowed it, or is this customized already for ours?
It's customized for BCSD already. I took the headers and the main ideas and customized it for BCSD cost. So this is a real dollars for our district.
And remember, Mark, too, we haven't included that in this presentation, but remember, we do have CARE Act dollars, but again, those federal dollars are need to be spent by December 30th. And so that poses another problem after December 30th, because then we still going to have some of these additional costs. So.
Well, can any of those dollars to be used to buy some of these supplies? I mean, you could spend it by December doing that.
Yes, absolutely. And we will be using some of our federal dollars to support these costs. The funding that we would be using would be the learning loss mitigation funding, which we're still waiting to hear exactly how much we'll be receiving and when that'll be forthcoming. And then partnered with the challenge of how much can you purchase and store ahead of the December 30th, because then, we don't have a warehouse any longer other than what's attached to the building, which is in and out. We don't store. So different factors to consider.
Thank you.
And so as we meet as educational services team, in addition to the operating challenges, we've identified these specific teaching and learning challenges to share with you. So the ability to meet the demands of remote learning, i.e. technology connectivity, and this is both for staff and students. So we are preparing which I think is a very important message. We are preparing to launch the school year where every student and staff member who needs a device and that internet connectivity for our students will receive the hotspots, so that every student in BCSD at home has access to instruction support. That, as we see in the feedback, is the #1 challenge in our community. So we're going to address that challenge and make sure that our students can access their schoolwork. But we also have teachers who identified don't have a computer with the camera on it and certain things. So we're going to make sure that they have a device they can borrow from their classroom on the school site. Challenge 12, the ability to ensure students are engaged and motivated. This is where our support staff, in terms of our MTSS, YSS, BIS, social workers, and psychologists come into play. Regularly engaging with our students who are disengaging from the school setting, checking in with them. How are you doing? What can we do to help you? Check in with parents. We want to make sure that we build a structure where every child is regularly engaged with and supported, and then we're monitoring their progress through school, especially when we see a long-term potential of having some blended learning be our path for this coming year. The ability to ensure teachers are engaged and motivated too. I have the privilege. I live with a BCSD teacher, and I got to experience the pressure of homeschooling 2 girls and fulfilling her responsibilities as part of Voorhees' team. We have to make sure that we are understanding of our staff, that we are building a level of expectation for our instructional program, but that our teachers feel like, I can do this, I'm confident to do this, I'm going to go and do this for the district for my kids. Otherwise, we're going to build frustration, resentment, and that's not going to be good for any of us. And so we want to work with our teams, with our staff, listen to them, support them, and build a successful plan moving forward. So we want to make sure that we are engaged with our staff and understanding what the pressure points they feel as we move forward.
Just something real quick. I'm looking at 4 students and 1 teacher.
Right.
Is that ratio about what it would be?
So this is what a traditional kind of small group, this is like a kindergarten class here, Reverend. And so project this into this year, you would have the teacher further away, and you would have as many as 2 kids there spread out. And potentially some plastic barrier between the kids and a face mask the teacher's wearing. But that's kind of how to project that idea forward.
And are we working out systems so that kids will actually be able to be graded this year between the online learning and classroom learning and stuff?
Yes. Let me go through challenge 14. I'll answer your question, Pam, because yes, I'm excited to share what our progress is. So then we have to make sure that we meet the needs of our most intensive populations in this distance learning format, i.e. special education students, i.e. English learners, i.e. African-American students, every child who's underperforming, foster youth, homeless students. So to answer your question, yes, we are actively developing a synchronous learning plan, meaning that kids are learning with their classmates in real time so that we can measure and grade for feedback how kids can grow their learning and improve their grading. Ultimately, it is a major task of our curriculum subcommittee to develop what that looks like out. And I will have an update for you probably next week on some work we're doing with grading as a district as well. So yes, our plan is that no longer as moving to next year is there the credit, no credit, pass or fail. Our kids need to acquire real grades. We have to make sure we build a system that supports that to happen, and that teachers aren't stuck in how do I grade a paper packet. This is why the devices in homes, the connectivity in homes, and ultimately that Google Classroom platform is going to be critical for our teachers, especially in the 3rd through 8th grades where we are giving letter grades as part of the experience.
Thank you.
You're welcome. So moving forward, what is our plan to, and I guess beat me to the punch here, to accelerate learning? Our task force subcommittee, along with our mental health subcommittee, is really working to develop a strong, sensible plan to support our teachers. Our goal is to offer one-to-one devices and connectivity for all low-income, English learner, homeless, and foster youth students. This will transfer into our LCAP document in December, but this is a priority. Again, as we see this distance learning reality, this has developed into the #1 issue for our district. And then strengthening our virtual pathways to support both synchronous, real-time live engagement and asynchronous learning, which is kids engaging in learning after and outside the classroom.
Yeah.
And Mark, I think, and Pam, just as a reminder, even if we do move in this synchronous learning model, remember, even though Mark's going to bring forward the plan in July 14th, they're still going to need another 20, 30 days to still continue to work out all these kinks. So the plan will be presented on July. It's not, it won't be final, obviously. There's going to be some changes between July 14th and the first day of school.
Yeah, understandable.
Okay.
Probably even after school starts, there will be changes to the
Ongoing.
plan.
Yeah, ongoing adjustments. So that takes us to our survey, and this is really raw. It's not beautiful. We captured real-time data as of the 10th, which was last week. And so for our parents, as of that date, we had 1,369 responses. We're already over 1,700 responses as of this morning. So every day that number is growing. The survey will be open to our parents through June 25th, and it'll close at the end of that business day. So we can compile the data into nice slides to present to you on the 14th of July. But some of the high-level data that we captured here, kind of where do you as a parent fall into our continuum in terms of a TK parent, a 7-8 parent, or a parent across both grade spans. And so we asked about what the work arrangement is going to be like and how many parents will be working from the home versus outside the home. This is all going to be impacting our potential daycare conversations if that comes up. And so we see here that the vast majority of our families, will have some responsibility of working inside, outside. And so I'm sure that's going to be a pressure point for us as we finalize our plans. Very important question here. This is one of the ones that I was really trying to track and monitor. So if you recall, recently I shared that when we had one of the recent SPAC meetings, about 15% of the parents in that meeting voiced a desire for something other than returning their kids to school, a non-return, virtual learning. And as we track this survey for parents, 14.3% are saying that they are still looking for that alternative option rather than sending their kids to school either full-time, which is 50% right now, or some combination, which is 34.7%. So we're going to have anywhere between 3,000 to 4,500 parents who are going to want something other than school, and which is why that virtual learning coordinator comes into play for the district. In terms of, if we modify the return to school plan and adjust to ensure social distancing, now what is your likelihood to respond? And once again, it didn't really factor into the data much. Still 13.1% wanted the virtual only option. So we're going to have a large number of students and parents who are going to opt to stay home and learn from home during at least the start of the school year. Our plan in July is to begin to engage parents and identify who these parents are so that we can work to identify how we're going to integrate them into an instructional plan to support their at-home learning. We talked about transportation. What will be the transportation need? And we typically transport about 30% of our students. So this data point is tracking with the average for the district. We're going to have a need. How do we meet that need, if at all? And currently, looking at our scenario, it's going to be difficult to offer transportation to all who need it. Device access at home. Again, we want to gauge how many folks have a computer, who does not. 23% of the respondents are utilizing a district-issued device, which is good to see. We have to identify this 18% of students and deploy devices to them in late July and early August. And then we have to also identify this 8.1% to provide them the internet hotspot capability so that they can access remote learning. Go ahead.
Mark,
Yeah.
Excuse me, on the ones who don't have a device, we didn't give devices to second grade and below, did we?
So we didn't at the on the onset, Pam, but what we did was we informed folks that if they wanted a device, call us and we will assign. We called every English learner parent and every migrant parent during the month of May to issue devices so that they would have the devices for the summer so that they could access our virtual site. Parents listening today, if that's a need, call our helpline and we will get you a device issued to you. So we're also running the return to work survey for staff, and we've had a great response, 1,858 responses as of last Thursday. And the questions here are really around comfort level of returning to work, given the CDC guidelines at the time, because the California Department of Public Health and CD had not yet released their guidance. And so when we ask about, I'm comfortable returning to my full-time work location following the guidance, mask, social distancing, sanitization, 59% said they were either comfortable or very comfortable returning. And 41% said otherwise, or give or take that number. So there's issues there with comfortability. When we asked on a scale of 1 to 5, how comfortable were they returning to work with all students physically present? Again, we see 50% saying, okay, I'm comfortable, and the other 50 saying, I'm not. And this was only for our folks who work in classrooms, scaled down from the previous question. When we asked the scenario, what if we said only half kids would come back at a time? And we would still follow all of the guidance from CDC. Still, the number was 63% said they were either comfortable or very comfortable. And so again, we still have a good number who are having reservations. And we talked about the scale of only a quarter of kids coming back at a time. The number went up slightly. We're at 66% now of folks who feel comfortable or very comfortable. So there's still a lot of hesitation out there, understandable, which is why we have to ensure that all of our protocols for sanitization and safety are in place, so that we are maintaining a healthy and safe work environment. And then we ask questions about comfortability of teaching virtually. And once again, 57, almost 58%, 58.4% of our staff feel comfortable or very comfortable doing this. I'm confident to do this. And so to answer Pam's earlier question again, we are going to need to provide training so we can build up that confidence level for our teachers. And that'll be an ongoing journey for us throughout the course of the year as we integrate technology more regularly into our programs. So coming back to some previously spoken language in terms of our scenarios, just know that we continue to evaluate these 4 options without identifying what is our favorite, but looking at it is very likely that at some point next year, we will navigate between these scenarios given conditions both within and out of our control, i.e. if people get sick on campus, i.e. community conditions. And it is certainly my goal and my hope that at some point next year, we can get all kids back to school and get back to traditional school. But we're looking at scenario one of all kids returning, which again, per the most recent guidance from CDE and public health, it's highly unlikely that we can do that. So we look to the next scenario. 50% of students would attend school 2 days, and then the other half would come 2 other days. And we are currently looking at what other districts are going to do, and we want to make sure that our schedule aligns with other districts if we all go 50%. So currently it's being presented to you as a Monday, Tuesday schedule, Wednesday, deep cleaning, teacher prep, professional development day, Thursday, Friday schedule. It very well could be a Monday, Tuesday, Wednesday, Thursday. That is still yet to be told and determined. Scenario 3 would be a quarter of kids would attend 1 day per week and they would do 4 days virtually. And then scenario 4 would be all of our kids would be distance learning again. And so we move forward through this with, again, we are going to follow the guidance and build our expectations based on the guidance to ensure a healthy and safe environment for our students and staff. We are looking at a 50% scenario in terms of how do we support teachers to deliver content in person, while also developing and delivering that online support on the 3 non-school days. If we can develop a synchronous learning plan, kids will be able to access instruction from home, which is the best case scenario, but we are working through those challenges as we build that system out. Scenario 3, 25% of students attending school 1 day per week. Again, same idea. Can we build out a system where kids engage from home and are watching, observing, and learning with their peers in an environment to help reduce learning loss and reduce impact to every extent possible. But this would be 4 days virtually. And then in the most challenging of scenarios, we would be back to a fully virtual platform, better equipped this time because all of our kids would have devices, but yet still challenging to meet the needs of our most needy population of students.
And Mark, on these scenarios as well, we should remind the board that some of those scenarios depending upon what the high school district is going to be doing as well. So I'm still having weekly meetings once or twice a week with the Kern education partners, which is Kern High School District, Hannibal, Buena Vista, Greenfield, and then the Kern County Superintendent of Schools. And then once a week, we're joined by the CSUB president and the community college chancellor. And during those conversations, we were talking about what do these scenarios look like for within our school system. So a lot of it, some of it will depend upon which way that Kern High School District goes. Right now, I know they've been talking Monday, Tuesday, Wednesday, Thursday, off Fridays. We've talked about Monday, Tuesdays, deep cleaning on Wednesday, then Thursday, Friday. So we'll probably know more, hopefully by the 14th of July, but we're going to continue to have those conversations, monitor on what scenario they select. And then we want to make sure we're closely aligned because of a number of reasons, and mainly being siblings.
Yeah.
A lot of our students. Go ahead, Lillian.
I'm sure the viral activity in the community is going to influence that. I noticed that in Beijing, they had closed schools now after they had opened up. So that'll have to be a great influence on, which option to take.
Yep.
And what I voiced to my team in Ed Services is we have to be prepared for every scenario because parents are going to ask for different things. And the reality is we want to meet our kids where they are. And if that means fully virtual, okay, we'll make that happen. If that's a combination of factors, we'll make that happen too. And which is why we continue to look at all 4 scenarios as realistic to plan for. Because again, I'm hopeful we can get back to more kids at some point during the year. But the reality is I do see us fluctuating between the 50% and no kids at different points of the year, given, to your point, Lily, in Beijing today, closing schools down because of infection. So we'll be prepared. Regardless of what the conditions are, we'll be prepared to respond, and we'll work with our staff to make that successful. So while we look at the global high-level 30,000-foot view organizational leadership of this response, please know that our special education, our state preschool, our English learners, our extended learning programs, aka academies, our migrant education, our VAPA, our after-school sports, our FACE, our scheduling of events and gatherings, and all of our consultants and visitors, contracts and policies are all being prepared and updated for the start of school. Kudos to all of the department leads for actively working to develop a response plan across these areas. And just know that when we look at topics like after-school sports and large school gatherings and events, our inability to have those is not our lack of desire to have those. It's just not safe to do that right now. And
Yep.
so we're going to be limited in what we offer our kids. And it's going to hit from the beginning. So the traditional back to school night, that's going to be impacted. Camp Keep, that's going to be impacted. There are the historical events that schools have done for a long time that likely won't happen this year. And we understand and appreciate everyone's passion for those types of events and activities, but we are adhering to the guidance, and as a result of that, we are not able to offer the traditional types of programs. Same to be said for our consultants and our visitors. We are going to take a different approach to bringing consultants and allowing visitors on the campus. This also means our parents the first day of school. It's a different reality. So again, I have to just ask for everyone's patience and understanding as we develop our protocols that are going to make some people upset and raise questions, but it's all meant to support the health and safety of their child, our students, and our staff as we launch into this next school year. And so just the road ahead, the complexities of our district require additional time to give consideration to the necessary protocols and practices essential to ensure our students and staff return to a safe place to learn and work, which is why we're taking our time to identify our pathway. And then ultimately, our next steps continue to be, we continue to evaluate the myriad of guidance documents to help us formulate our protocols and expectations for staff and students for a final return to school plan. We want to continue to finalize our instructional programs, social, emotional, and trauma supports, ensuring that we develop an integrated approach to onboard students back into school, and that we continue to communicate with our board, with you, with our staff, our community, stakeholders, as we finalize our return to school plan. And with that, I appreciate your questions and attention today, and I'll ask if there are any final questions.
I have a question, Mark, about the scenario 2 and 3, because I did read through the whole book. I did finish it about 5 o'clock this morning. But
Go back to the slide.
I noticed with your scheduling, you had like K-5 scheduling and then junior high, middle school scheduling. So I'm just wondering, how are you treating 6th grade at that they're at the elementary site? Because it just sort of seems like they're going to be up in the junior high, middle school. You know, I don't see them at the K-6 sites. Follow what I'm saying?
Yeah, I follow what you're saying. So you raise a great question that we continue to discuss and dialogue. When we say 50% of students attend school on any given day, or 25%. Are we saying equal, meaning you're either going to get 2 days in person, scenario 2 versus scenario 3? So every child in BCSD gets access either 2 days a week in scenario 2 or 1 day a week in scenario 3? Or are we going to approach this discussion through the lens of equity and identify, in making up half of the enrollment, are we going to prioritize which students make up that 50%, i.e. special education students, English learners, i.e. low-income students? And there's pluses and deltas with both scenarios. And so we're having those conversations as we prepare to present our return to school plan. But we would look at it solely, Pam, to answer your question, as a school configuration question. So we would want to, at this point, divide a 6th grade classroom up of half and half, and then you'd have to factor in any families who would take the fully virtual route to subtract those kids from that class size. And then we run into the reality too that we have to make sure that those desks in that classroom fit 6 feet apart from each other. So
Yeah. Well, I guess my concern was 6th grade was in the plan was put at the junior high, middle school level, but I didn't see 6th grade at the sites that are K6, because the sites were, you were talking about K5 or TK5, but in the plan you didn't have any TK6.
yeah, that's my fault. It's an oversight. It should have been the TK. It should have been TK5 for those sites. It should have been TK6 for those sites.
Okay, that's what
Yeah.
I thought. That's probably what you meant, but I just wanted to make sure that was the case.
Yeah, we'll make sure we clarify that the next time around.
You know me, I'm always picky about 6th grade.
Oh, it's your passion. I get it.
But Pam and the board, going back to thank you, Mark. Mark did a wonderful job, him and the team, to putting forward this presentation and then these guidance documents or expectations document. But remember, regardless of which plan we think we select or choose, we just got to make sure that we ask that our community members and our stakeholders have patience and support our efforts going forward, because there's going to be someone who's going to say that I'm not very happy with this scenario.
Oh, yeah.
But again, there's no way it's going to be 100% foolproof. And so, but I do think, Mark, you and the task force and the subcommittees are looking at each one of those challenges operationally and instructionally, and trying to make sure that you guys try to mitigate all those challenges. But again, we ask that everybody be patient when we present the final plan on July 14th. Mark, anything?
So,
No, I mean, no, you said it, Doc. As we go through this, I do anticipate adjustments beyond the July 14th date, and we're all going to have to be flexible and agile as we navigate the conditions in the community that dictate how we start school. But just know that we will be prepared as a district to receive kids back